Hello, my name is Laura Turpin, and I serve as the regional epidemiologist for Coos, Douglas, and Josephine counties in Southwest Oregon. Anne asked me to share a little bit about hepatitis C from a local public health perspective. So, as you're probably aware, laboratories and healthcare providers are required by law to report positive results for certain infectious diseases to public health. In Oregon, these results are sent electronically to a surveillance system called Orpheus. Every county has at least one epidemiologist or nurse who reviews lab reports and investigates new cases. We are required to investigate hepatitis A and B cases, but case investigations for hepatitis C are not required due to the high number of reports that we receive. Hepatitis C is our second most common reportable disease. It is surpassed only by chlamydia. Historically, local public health departments have not done very much with hepatitis C lab reports besides counting them. There's a huge caseload. There's an estimated 95,000 people infected with hepatitis C in Oregon. In my prior role, I used to call newly diagnosed cases under the age of 30, but that was really just a formality to make sure that they were getting informed. Treatment used to not be very effective or widely available. Thankfully, that reality has now changed. Many of you have been doing the hard work of helping patients get linked to treatment. You are preventing cancer, cirrhosis, and saving lives. The three counties I work for feel this is inspiring and important, and the progress we're making should be measured. If we want to move towards elimination of hepatitis in Oregon, we need to start counting who has been treated and who has not. So earlier this year, we asked the Oregon Health Authority to add hepatitis C treatment fields into Orpheus. On November 6th, these new fields went live. The new status options allows us to enter things like if a person's been linked to care, their treatment started, treatment interrupted, treatment completed, if they had sustained virologic response or they're cured, and if they were reinfected. Each of these options, we can now enter dates and the place that they were treated. Now that we can track what stage of treatment patients are at, there's an opportunity for local public health to partner with healthcare partners who are treating hepatitis C patients. Local public health epidemiologists and nurses have access to lists of thousands of people living with hepatitis C, many who are unaware that they have tested positive, or if they are aware, they may be unaware that treatment exists or how to get it. So I wanted to speak today just with some call to actions about this. And my call to action for my colleagues at local health departments would be, if your capacity allows, please refer patients to hepatitis C treatment through your healthcare partners, and then enter this treatment data when completed. My call for OHA would be to find a way to financially support LPHAs to do this outreach, if possible. And my request for healthcare partners and peer navigators would be, firstly, to keep up the amazing work that you're doing. In addition to treating hepatitis C, you're helping prevent hepatitis A and B through vaccination. By ordering blood tests, you are helping public health identify new HIV and syphilis cases as well. If you do get these positive results, please call us to report them. And finally, if your local public health department has capacity, please consider sharing with them lists of your patients who have been treated for hepatitis C so that they can enter them into Orpheus. My hope is next year we'll be able to have a better picture about where we are with treatment of hepatitis C in Oregon. Thank you very much for giving me this brief space to talk today. I am looking forward to the discussions. Thank you so much.